In this tutorial, I'll be describing the movements of the wrist joint. Anatomically, we refer to this joint as the radiocarpal joint because articulating to form it, we have the distal end of the radius and some of our carpals. Here we have scaphoid, lunate, and also triquetral. This particular joint is described as a synovial condyloid joint because movement can occur in two different planes. Demonstrated in this animation are anterior forearm muscles, and they help to produce flexion of the wrist joint. You can see here that the angle at the joint decreases when these muscles concentrically contract. Demonstrated in this animation is extension of the wrist joint, and you can see that these muscles that help to produce this movement are on the opposite side of the wrist joint. They're on the posterior side. Demonstrated in this animation is abduction of the wrist joint, and this particular movement occurs within the frontal plane, whereas flexion and extension occurred within the sagittal plane. Highlighted here are also some of the muscles that will help to produce abduction at the wrist joint. Lastly, we have adduction of the wrist joint, and you'll notice that the muscles that help to produce adduction of the wrist joint go specifically to the medial aspect of the hand. This is opposite to the muscles that help to produce abduction of the wrist.